There are many reasons why a woman will be told the best route of delivery for her will be through a cesarean section. And if it was discovered during your antenatal care, it's going to be a planned cesarean section, what we call an elective cesarean section, as against an emergency cesarean section that was not previously planned. Like I said, in this section or in this video, I'm going to share with us 14 very common reasons. The first reason, in no order of preference, is what we call fetal malpositioning or fetal malpresentation. What does this mean? It means that the baby is not lying the proper way he or she should lie in the mother's womb. Now, this is the plane of the mother. This is how the mother stays or how the mother lies down. In the womb, it is expected that the baby also lies this way in her womb, with the head this way. The head should be down towards the pelvis, especially very late in the baby's third trimester. But when we have malpositioning or malpresentation, I will just attempt to use these two terms very loosely, interchangeably, even though it does not necessarily mean the same thing in medical terms. In malpresentation, the baby is not coming with the head. It means that the head is not down the pelvis of the mother. What we call breech presentation. So in breech, essentially, the head is usually up this way and the buttocks and the leg down this way. Again, the head may not necessarily be up this way. The head may be somewhere down, but it's not directly in the pelvis. The head will be somewhere by the side, either to the left or to the right. And in that situation, we say that the lie is oblique. It means instead of the baby lying in the plane of the mother this way, the baby is this way. So the head can be up here and the buttocks and leg this way, or the head can be down this way, but not in this direction, in the line or the plane of the mother. In other malpositioning, the baby's lie, instead of in this plane, the baby may lie transverse this way. And like I said, the baby may be oblique. Especially in first pregnancies, it is usually very difficult to deliver by the natural method, that's to deliver vaginally. It is usually best if from examination during antenatal care or from ultrasound scan, it is revealed that there is malpositioning or malpresentation, especially in first-time pregnancies. Your obstetrician will usually counsel you for an elective cesarean section. That is one. Number two, when we have cases of multiple gestation, that is multiple pregnancies, by which I mean this woman is pregnant with a set of twins, a set of triplets, or even quadruplets. It is usually advised in most cases, especially where we have standard obstetric services that the woman can benefit from, that the woman delivers through an elective cesarean section, especially if the leading twin is not well positioned or is not coming with the head. In some cases, we see the leading twin being a breech presentation, coming with the buttocks, coming with the hand, coming with the foot, and other forms of malpresentation or malpositioning. It is usually advised in this situation that an elective CS is carried out so that at the end of the day, the delivery of these twins or triplets becomes effortless. Number three, when there's the presence of transmissible disease in the mother, it is usually advised that the woman is delivered via an elective cesarean section. Diseases like genital herpes that the baby could easily contact during delivery, if it is going to be a vaginal delivery, then the obstetrician would advise that the baby should be delivered via an elective cesarean section. HIV is another very good example of an infection that can be transmitted to the baby during the course of a vaginal delivery, especially if the woman is unfortunate to be in a community where she is not able to get access to quality antenatal care. Because during antenatal care, one of the things that the doctor would request to be done for the woman is baseline investigations that will include sexually transmitted disease or diseases of concern that the baby can contract during pregnancy or at birth. In other cases, the woman may be lucky to have benefited from quality antenatal care. She's taken her antiretroviral if it was discovered that she's HIV positive, maybe during pregnancy or before pregnancy, but she may be unlucky to have what we call treatment failure, in which case her HIV viral load may be very high, such that it will prove to be a risk to the baby that is to be born. This is another example, or this is another scenario why the obstetrician would advise that the woman would deliver a baby through an elective cesarean section. Number 4, we could have the placenta not being positioned in the appropriate place in the womb, what in medical terms we call placenta previa. Now, the placenta is supposed to be positioned far away from the mouth or the entrance of the womb, which is the cervix. But in cases where in pregnancy, especially in late pregnancy, ultrasound scan or some clinical presentation points to the fact that the woman has what we call the placenta previa, then it is usually advised that the woman delivers through an elective cesarean section, because in this case, the placenta is close to the mouth of the womb, that's the cervix, and in some other cases, it could be so severe that the placenta is covering the mouth of the cervix, in which case it becomes almost practically impossible for her to have a natural delivery. With the privilege of having an ultrasound scan done ahead of time, or when there are clinical symptoms, maybe bleeding in pregnancy, especially at the end of, towards the end of pregnancy, it is usually advised that the woman is delivered of her baby through a planned cesarean section. Number 5, commonly we see cases where the baby to be born is too big, in quotes, is bigger than what his weight or her weight should be, what we call fetal macrosomia. The normal weight for a baby at term should be between 2.5 kilograms to 3.9 kilograms. At 4 kilograms, it becomes a cutoff for what the normal weight of the baby should be at the upper limit of normal. So for estimated fetal weight from clinical measurement or from ultrasound scan, when we have the estimated fetal weight to be 4 kilograms and above, either in first-time pregnancies or subsequent pregnancies, delivery may become difficult for the mother. It may prove to be a risk for the baby to be born. When this is noticed during antenatal care of the pregnant woman, it is advised that the woman should be delivered through a planned cesarean section. Number 6, prolonged period of infertility. And the woman now achieves pregnancy naturally or spontaneously. The baby in her womb is usually regarded as a special baby. If there is a set of twins, we say there is a set of special babies. Because of the rigor and the possible complications of labor and vaginal delivery, and the fact that the woman or the couple has stayed for a long period of time, it is usually advised that babies in this case, babies in this scenario, be delivered through an elective cesarean section. Closely related to that is babies whose pregnancies are achieved through assisted reproductive technique. For example, ICSI, IUI, and very more commonly, IVF. Again, these babies are usually regarded to as special babies because of what their possible risk would be during labor and vaginal birth. It is also advised that they are delivered through an elective cesarean section. Number 8, we've had cases where a woman has what we call a poor or bad obstetric history, by which I mean this woman gets pregnant, maybe more than once, 2, 3 times, but close to delivery, during delivery or shortly after delivery, the baby dies for one reason or the other. By the time this is repeated 2 or 3 times, she has a diagnosis of poor obstetric history. When she has a subsequent pregnancy and she has the advantage of having quality antenatal care, this type of woman is usually counseled and prepared for an elective cesarean section. Number 9 common reason why a woman would be advised to deliver a baby through an elective cesarean section is advanced maternal age. In obstetrics and gynecology, a woman that is 35 years and above, all of the risk that surrounds labor and delivery is heightened in her. So essentially, our obstetrician will usually advise her that, madam, because of your age, and especially in the presence of a few other factors, period of infertility, assisted reproductive technique to achieve pregnancy, bad obstetric history, multiple pregnancies, a woman that is 35 years and above is usually counseled to be delivered through an elective cesarean section. Number 10, there are cases where this woman is pregnant, her pregnancy is smooth, there are no issues, but her pelvis is malformed or too small for the baby to be delivered. We have cases where we say a woman has a borderline pelvis. It means it is just a little away from what the female pelvis, that is the bone of the hips, what it should be like, or what we even call an android pelvis. It means that she's a woman, but the frame, the bony skeleton of her pelvic region looks like that of a man. Nature designs the pelvis of a woman to be able to go through natural delivery for her babies. But when there is borderline pelvis, when there is an android pelvis, or other forms of malformed pelvis in a woman, then she's counseled to have a baby through an elective cesarean section. Number 11, when we have histories of gynecological surgeries, topping the list here is myomectomy. It means that this woman has had a fibroid operation. And especially when the fibroid operation is such that cutting through the womb, the internal lining of the womb is breached during surgery, it is important, it is advisable, it carries less risk that she delivers her babies through an elective cesarean section. The womb that has gone through an extensive myomectomy or fibroid operation is always at a risk of uterine rupture during labor and childbirth. So it is usually advised that for women that have had myomectomy, that have had fibroid operations, especially if it is extensive, it is usually advised that they deliver their babies through an elective cesarean section. Closely related to that is what we call uterine rupture. It means that in a previous pregnancy, labor went the other way around. It became complicated so well that her womb tore. There was a renting of the uterus. And again, in that situation, she is lucky not to have had her womb removed. But the obstetrician was able to come to the rescue, deliver the baby, and now sutured back or repaired her womb. In this type of situation, the womb is not what it is normally again. The chances that she's going to have another rupture during a natural delivery after a previous uterine rupture is very, very high, and this poses a very great risk to her and her unborn baby. So in this type of situation, the obstetrician would usually advise the pregnant woman again that her subsequent deliveries or the delivery to be taken for the index pregnancy should be through an elective cesarean section. Number 13, the case where we have a woman that have had previous cesarean section. In the developing countries of the world, especially in Africa, if a woman has had one previous cesarean section, and whatever was the reason for the cesarean section is not a factor that is present in the index pregnancy, the woman is usually allowed to have what we call a VBAC, VBAC. It means a trial of labor, what we call a vaginal birth after cesarean section. While all hands will be on deck while she's going to be closely monitored for any complications that will put her life or the life of the baby at risk, such that at that point, a trial of labor, or what we call a VBAC, will be converted to an emergency CS. In the Western world, once a woman has a cesarean section, her subsequent pregnancies will be delivered through cesarean section. But just like I said, in the developing countries of the world, after a first pregnancy, she could be allowed to try labor. But after 2 previous years, every other baby would have to come through another cesarean section. And in this case, if she has the opportunity of quality antenatal care under an obstetrician, then she would be planned for an elective cesarean section. This would help her to reduce her risk of uterine rupture that would be a risk to her and the baby to be born. The 14th reason is a case of maternal choice. There are instances when the woman has had many things about what other women go through in labor, and what she would want eventually is, I would want to deliver my baby or my babies, all of my pregnancy should be delivered through an elective cesarean section. This is purely based on maternal choice, or a choice and the choice of her spouse collectively. These are 14 common reasons, amongst others, while an elective cesarean section will be carried out on a pregnant woman. We must remember that the essence of an elective cesarean section at the end of the day is that we are able to improve our maternal health outcome in rural Nigeria, in sub-Saharan Africa, and other developing countries of the world. What we want at the end of every pregnancy is that the pregnant woman and her baby or babies are alive and well at the end of pregnancy. Please, if you've not subscribed to my channel, you will do well to subscribe and hit on the notification button so that in my subsequent videos, you won't miss out on any.